All right, let's jump straight in. Today, we are taking a deep dive into something really interesting. India becoming this major global hub for medical tourism.
Right. Yeah.
We've been looking at a YouTube video that kind of explores why this is happening, what's drawing patients there.
Especially from certain regions, it seems.
Exactly. So our goal really is to try and get to the heart of this shift. Understand the key reasons India is now the go-to place for specific medical needs.
And what immediately jumps out, I think, from what we saw is the incredible progress India's made in its healthcare sector specifically.
Okay.
They've been investing heavily in training these highly specialized super specialists, they often call them.
Super specialists.
Yeah.
Like people doing really complex procedures.
Exactly. Complex surgeries, treatments, stuff way beyond general practice.
That specialized expertise, it's clearly paying off then. The video even gave a specific number that, it really brings it home.
Oh, yeah. What was that?
India now has a doctor-to-patient ratio of 1 per 1,000 people.
1 per 1,000. Wow.
Yeah. That number, it signals a pretty significant increase in their medical capacity, doesn't it?
Yeah.
Especially at that advanced level.
It absolutely does. And you see that reflected in a trend the video highlights, a definite shift in where patients are traveling for certain treatments.
A shift.
Yeah, apparently this started becoming really noticeable around 2012, I think it was.
Okay, 2012. And this is where it gets really fascinating because the video tells us that before 2012, many patients looking for these specific treatments were actually going somewhere else.
South Africa.
South Africa, yeah. So the big question is why? Why the change? Why did the flow sort of redirect from South Africa to India?
Well, the core reason pointed out is pretty straightforward. Cost.
Oh, okay. Money talks.
Basically, South Africa, while it was an option before, was just considerably more expensive.
More expensive, right.
And the video's key finding really is that India came in significantly cheaper.
And hang on, this wasn't just the price tag on the surgery itself, was it?
No, that's the crucial bit.
I make it clear India was more affordable even when you factored in the extras.
Exactly. Things like airfare to get there, hotel stays, all of that.
So the total package price, that difference must be a massive driver.
A huge driver. The overall expense was just much lower. But, and this is important, the video also stressed another critical factor alongside the cost.
Which was?
Quality of care, the outcomes.
Ah, right. Of course.
They described the medical outcomes in India for these specific procedures as, great.
Great. Not just good enough, but great.
Yeah. So you're getting both things. Significant affordability and excellent results.
So it's that powerful combination then. Great medical results, much lower total cost, including the travel. That's what the video identifies as the main force behind that shift, from somewhere like South Africa to India, at least for these types of procedures.
Seems to be, yeah. Primarily for those things they used to seek out in South Africa.
Understanding this specific example, it really helps you see the bigger picture, doesn't it? How global healthcare access and, delivery are being reshaped by affordability and quality.
It really does. And, this raises a pretty important point for you, the listener, to think about.
Okay.
If high-quality, specialized medical treatment becomes dramatically more affordable in places like India, well, what does that imply? What are the wider implications for global healthcare competition, for access for patients everywhere, even for healthcare systems in, more traditionally expensive countries?
Right. It's a trend with potentially huge ripple effects.
Exactly. Something to definitely mull over.